Hello everyone, this is Shabnam here. Welcome back to my channel, The Counseling Corner. As you all are aware that September 10th is observed as the World's Suicide Prevention Day to create an awareness among the people that yes, suicide is preventable. More than 7 lakh people are losing their life every year due to suicide, and the number of people who are attempting to end their life is much more. So in today's video, we are going to see why are these people taking such a drastic step to end their life, as well as I will give you a few tips as how you can cope up with your suicidal tendencies as well as depression. See, if you're experiencing suicidal tendencies, then you should immediately contact the National Suicide Prevention Hotline at 988. The major contributing factor for the suicidal tendencies or suicide is depression. So when a person is undergoing depression, the person experiences an intense emotional pain and negative feelings like feeling of helplessness and hopelessness. Sometimes the pain is so overwhelming that the person feels that the only solution or the only way to get rid of this pain or escape this pain is to end their life. There are other contributing factors like if the person is undergoing post-stress syndrome, or if the person is into substance abuse like alcohol or drugs. If the person is having an intense fear, it could be any sort of fear like fear of failure or fear of examination or fear of death, any sort of fear. Or if the person is experiencing intense pain, or if he's having some disease. Or sometimes if a person is dependent on someone, he feels that he is a burden on someone due to social isolation, that is loneliness. It could be due to retirement, due to loss of the partner or any reason. Some cases, if you see, the person seems to be very happy. Everything seems to be going fine in his or her life. They're doing very well. But one final day, they just end their life, leaving everyone clueless why they've taken this drastic step. So now I will give you a few tips as how you can cope up with your depression as well as your suicidal tendencies. The first and foremost thing is that when you're experiencing such feelings, you should immediately get into touch with the Suicide Prevention Hotline at 988, where you will find some counselors to ventilate all your feelings. This is free of cost, it operates 24/7, and you need not reveal your identity. But sometimes the counselors might ask you few questions just to assess your suicide risk. But most of the time they'll allow you to ventilate your feelings, they'll give you some resources, as well as they will guide you to make a safety plan for yourself. The second thing is that you have to make your environment safe. You have to remove all those items in your house if you're staying alone, which you might use to harm yourself. It could be a knife, a gun, or pills. And it is always better that you go off to some other place and stay. Maybe you go and start staying with your family or stay in some friend's house, and avoid staying alone. The third point is that if you're experiencing suicidal tendencies or you feel really depressed, you need to express or ventilate those feelings with someone whom you trust. It could be your family member or your friend. Tell them how you feel. Tell them that you are suicidal and take their help. The fourth point is that you can also get in touch with your doctor or your psychiatrist and talk to them about how you feel. See, if in case you're a person who's already taking treatment for depression and you are experiencing suicidal tendencies, you should immediately inform your doctor about that, so that the doctor can change your medicines, or he might prescribe some antidepressant drugs, or if the case is severe, he might also get you admitted in the hospital and you can be treated under supervision. The fifth point is that avoid consuming alcohol and drug. I have seen in many cases that people resort to alcohol and drugs as the way of coping up with their emotional pain or depression. But this will only aggravate your feeling of sadness and feeling of hopelessness and helplessness. So instead, what you can do is that start practicing self-care, start doing exercise, start going outside and socializing with people, start doing meditation. This would in turn help you. The sixth point is that practice gratitude. See, in most of our life, there are so many things, positive things are happening, but why are we feeling depressed? Because we are focusing only on those negative things. So when you start thinking of those positive things which happened in your life and you start writing it down, you will feel much better. The seventh point is that do some introspection and try to understand what is making you feel depressed and what is the cause for your emotional pain. For example, it might be because you lost someone whom you really love, or it might be because you lost a job. For example, if you have lost a job, then you have to find a solution for that. So you can go out and meet some people and try to ask their help to find a job, start applying for jobs. You can also enroll yourself in some classes and try to upgrade yourself. Eighth point is that you have to distract yourself. See, sometimes when you're not sometimes, you can say most of the time when you're depressed, what do? You become very withdrawn. You don't like to interact or mingle with anyone. You're confined to your house. Instead, force yourself to go out, start meeting people, start interacting with people. You go for a walk, you can just go and for shopping, and even if you don't have money, go for window shopping. So just keep yourself distracted from those negative thoughts and feelings. See, the last tip is that you have to recall your past challenges, your past problems, and how successfully you overcame it or coped up with those. This is what I do. Anytime I feel low and depressed, I think of my past challenges and then I get the strength. I feel that this is nothing. I will overcome it. So these are few tips which you can adopt to cope up with your suicidal tendencies as well as depression. But remember one thing. In case you're having suicidal tendencies and if you feel depressed and you feel that this feeling of depression is persisting for quite some time and it is affecting your health, it is affecting your relationship with others, it is affecting your productivity and work, then you should not avoid. You should immediately get in touch with a psychiatrist or a mental health therapist and get a consultation. So in case you like this information and if it was useful to you, please do pass it on as it is the need of an hour. And do like, share, comment and subscribe to my channel, The Counseling Corner, as well as hit the bell icon so that you get timely notifications whenever I post my new videos. Thank you so much. See you next time.